room 2 and room 3, who's presenting? We can start with room 4.
I will present for room 2, Dawn.
Dawn, oh, all right.
Yeah.
Okay, Mungabo, you can start for room 4, and then we'll move to Dawn.
All right. Hello, everyone. Dr. Chongo Mungabo from Zambia. I'm part of room 4. We had a very, very nice session. Unfortunately, I think we didn't have too many people in the group, but we still had a good time. So when we read the case study, what we took most away from it was the emphasis here was not how to create a health management information system, but mostly how to navigate its introduction into a facility, most likely a government facility, where most of the people seem to be averse to the notion of adopting the system. So to answer the first question, as a group, we're thinking, well, a health management information system is mostly an aggregate collection with subsequent analysis of information that is gathered from a health facility from the lowest level. This information is related and it gives us mostly characteristics about people and the health conditions that they have and how we can relate all of this and synthesize it in a systematic way. And most importantly, what we wanted was, what we emphasized was that the information within the system should be accurate data. Around what was wrong with the picture, that's question 2. We thought the biggest issue here was that there was very poor peer education. There wasn't sufficient social behavioral change communication provided to the staff facility. We noted that it seems like there was an external partner that came in for just a few days, 3 days, to mentor one person. And it seems clear that this one person wasn't very attentive when they were being mentored. And therefore, even as they were playing the role of trainer, because initially when they were being trained, they weren't very attentive. It seems that subsequently, everyone else also didn't get the grasp of what was going on. We also noted that this situation where an external partner comes in for a very short time to train someone on something and then doesn't give subsequent mentorship. The mentorship became fragmented. People weren't able to get back to them, and this disrupted the uptake of this new information. We also noted that it seems like the whole program was a top to bottom approach. The people at the bottom didn't seem involved, they weren't invested. And that was one of the greatest challenges we noted. It seems like the information was being gathered for information's sake, and the information wasn't then being gathered in a way where the healthcare workers at this particular facility had the incentive of using that particular information. And because of this lethargy and all of the system failures, the fragmentation of the mentorship, the lack of social behavior change communication, inappropriate time given to learning the system, and even how the system was rolled out, it wasn't what do they call it? They didn't sample maybe one tiny department and reflect on how it can go on more effectively, but then they just brought it on large scale. So those are the main challenges that we saw. To answer question 3, we were thinking that some of the more important things as for leadership and governance at this particular facility is they should have managed this change by first providing adequate social behavioral change communication. Even when it comes to human resource for health, it would have been important to strategically analyze which people are needed and the numbers of people. So for example, in the registry, clearly they needed more people to be able to register patients quickly, to reduce the frustration. If the healthcare workers, for instance, example that comes to mind, when PEPFAR was introducing a client management system for HIV and AIDS positive patients in Zambia, there usually would be a technician in the room with the healthcare provider. And they were and this happened for several weeks, so that every time the healthcare provider had a question on how to use the system, there was someone readily available. And we realized implementing things such as this might improve the system. We also wanted to emphasize this notion where we adopt tech, especially in African countries, for adopting tech's sake. We just adopt it because there's a funder who wants us to adopt it. We don't know why we're adopting it. We don't know the reason, the benefits that it's going to have. We don't intend to use this, the outputs that are going to come from this system. Everything seems to be catered to national indicators. They seem to be dedicated to for research purposes. But as long as the people who are putting in the input, getting the original data, don't know why they're doing it, then we will always see such fragmentation. I think I should leave a little bit for the other people. So generally, this is what we came up with. This was like the core of the discussion.
Thank you so much, Mungabo and team, for that wonderful presentation and discussion that you've had. And I really like the fact that you've emphasized on the issue of don't adopt tech for tech's sake. Because remember, when we're looking at the steps to developing an HMIS, one of it was, what's the problem you're solving? Not just adopting tech. So thank you for that. So I'm going to move on to Dawn. Dawn, the floor is yours. Dawn, are you still there?
Yes, hello. I think I was muted by
right.
the host.
Okay,
Yeah.
all right, go ahead.
All right, so from our group, moving on to question one, of course, we had a number of challenges to access the case. Many of us had not yet did the pre-reading. But I think in terms of question one, we looked at the Health Management Information System, commonly known as HMS, as an instrument which could be used to improve patient satisfaction with health services by tracking certain dimensions of service quality. We also discussed to say it could be quality can be checked by comparing perceptions of services delivered with the expected standards. And I think there was one that came out as an academic definition, which we said it's a system that is used to record data, store, retrieve, process, and specifically designed to support planning, management, and decision making. We also looked at it as a system that facilitates the institutions to organize the data in a way that is effective and efficient, and also accessible for improvement of the service delivered at the institution. Moving on to question two, we looked at some of the things that came out in the picture as that were long, as the system was slow. It wasn't responsive enough to patients, as such patients could take longer or some were not receiving the treatment. In nutshell, I think what we came up over to was there was a gap between the ecosystem and the whole process. Like they did not pay attention to the change management, where they had brought in something new, but the change management was not well managed. We also talked about the issue of leadership, that it was really not done in a good approach. It was from top to bottom. The issue of internet, which also affected the delivery of the service. We also looked at the people were not willing to adopt the change in some sense. And again, we discussed on the issue of the training was inadequate, or the mentorship was improperly done. One person was trained and for a short time. So that also hampered the whole process. And I think those are some of the things that we discussed. We had to go to question 3, but I think time was not on our side. Nevertheless, I can just comment to say, I think the issue of leadership was really one of the key things, because they could have organized it better, made proper trainings, and making sure that they are responsive when the juniors have raised a complaint. On the other hand, I think it really appeared that the system was adopted just for the sake of adopting, but there was no really a key focus to improve the service delivery. Yeah, thank you.
Thank you so much, Don and team. I especially like how you conceptualize your understanding of HMIS. You mentioned it to be an instrument that can be used to improve patient satisfaction, amongst other things. And I think that from your group, that was an important point for me. Don't mind the academic definition, because the whole point of question 1 was to see how you conceptualize HMIS, because how you conceptualize something at the end of the day affects how you implement it, or how you accept it or reject it. So I really liked that component. We have room, Don was from room 2, if I'm not wrong. Room 3?
Yeah, yes, room 2.
Yeah. Room 3? Or did everybody leave from room 3?
Hi, my name is Pauline.
Hi, Pauline.
Yes, I'm from room 3, but we really had the problem of getting the case study. Actually, I got it myself towards the end when you just told us to come in.
Okay, all right.
I think all of us had an issue. So
because the case study is always sent to your emails before the class. That's one. And then I had also posted it on the chat before we started, and I asked people to open it, and a lot of people said yes, they had opened. So yeah, just for next time, just check either from your email or from the chat before we break out to groups. You'll find it there. Otherwise, no worries, no harm, no foul. Yes, so thank you so much. You guys are among the 10% we retained, because I was being told the statistic for retaining a class is around 10%. So in this cohort, we started with around 320 something people from module 1. So we are at module 6, and you guys have stayed. So thank you for staying. Thank you for participating. You're the ones who make these meetings worth coming to every single month. So I just want to encourage you to keep on keeping on. And in terms of today's case and everything that we have learned, one thing I want us to take away home is, what is your concept of health management information system? What do you understand by it? Because for you as a manager, as a leader right now, as a future leader, you need to be able to understand and conceptualize these things in such a way that when you explain it to someone else, they're more likely to accept it rather than reject it. That's why question 1 was there. What do you understand? What is HMIS to you? What does it mean to you? Is it an instrument? Does it mean IT? What does it really mean? So that is 1. 2, in terms of looking at the case, one important thing is they missed the person-centeredness of HMIS. Because remember, when we started earlier, we were talking about your human resource is the most important thing. It is the most important, one of the most important components of your HMIS. So if you miss the people part, you miss everything. Because at the end of the day, I'd like to ask just a question. Who was this system for? After reading the case, do you know who was this system for? Anybody can answer. Yes, Abe, who was this system for at Gito District Hospital?
I think this system is for the health practitioners and the active people in the list of researchers. also because it provides information for both planning and management purposes. So me, I will look at it as for policymakers and actually it's not specific to a group of people, but anyone who has interest in the health provision, I think the system is for them.
Thank you, Abe, for that response. And that would be the ideal. Ideally, that's who the system is for. But in this case, remember everyone was saying, I'm not the admin. So who was the system for? The healthcare workers are not using it. The registration clerk is too tired to use it. The MedSoup does not want anything to do with it. So just remember the person-centeredness of any HMIS. And you have two people to consider here, the people working within the system and then the people being served by the system. So even as you think of your system design, even as you think of how you're going to implement, how you're going to develop, let it be human-centered. Nowadays, we have a concept called human-centered design. Make sure it is designed around the people. The question was, did you understand at the end of the day what problem was being solved in this case? Anybody? For those who read the case.
I think it is updating. I think it is updating and digitizing the patient's record. I think that was the main reason. Hello.
Yes, thank you, Charles, for that response. Charles thinks it was digitizing the patient records. Mungabo? Mungabo, go ahead. You had raised your hand.
Okay. I think that's the problem. Because the scenario is telling us that we don't know why they are adopting this. We don't know who it's directed for. We don't know what indicators they're trying to get out of this. They haven't involved the healthcare workers. So no one is motivated and no one knows what's happening. And this is the reason why it is not functioning very well. And I think in most of these systems, we tend to see this a lot. Some global fund or some PEPFAR or some big funder would say, go do ABC. Someone would win what they called. Someone would win the
Tender.
The tender, yes, and they would have their objectives. Go to facility XYZ, put in these computers, train 2-3 people. You've got enough money for 3 days, and then that's all. So someone ticks and says, oh yes, this year in this quarter, we were able to do XYZ to strengthen healthcare systems in rural country XY. And then at the end of the day, it's not human-centered. There's no real value.
Thank you so much, Charles. You've actually hit the nail on the head. We don't know what problem they're solving. We don't even understand what they're doing. And it's the same thing with the health workers there. They also did not. So they failed with number one in decision making. What is the problem? Charles? And then I think we'll close because I think we are about 10 minutes over time.
Just following up from Don's submission, I think they are more concerned about the management ego or service centered, not actually patient centered. Because if they were patient centered, then they would do everything possible to see that they serve that patient well. to see that they rerun or test run what they have installed and see how it runs and how every person gets to be involved in the system so that it will be a seamless execution. So it wasn't patient-centered after all.
Thank you so much, Charles, for that comment and for reminder of being patient-centered. Because remember, the patients were outside waiting. The waiting times were increasing in the name of adopting a new EMR. Let's have some final comments. Let's keep it short. Dawn and Iska, and then we'll close our meeting today. Go ahead, Dawn, then Iska.
All right, thank you. I just need to agree with the rest of the members that it wasn't patient-centered, and they really never had a clear objective of what we're doing, because everyone was pushing, I'm not admin, and I'm thinking even the admin was asked, they wouldn't have specified what they really wanted. So I think that element was a big miss that in terms of decision-making, planning, all was missed at the beginning. Thank you.
Thank you so much, Dawn. Iska? Go ahead. You're still muted, Iska. Okay, I think Iska is having some challenges unmuting. You're still mute or there? Go ahead.
Yes.
And please
Okay.
keep it short.
Okay, what I was trying to say is that management information system guides us in decision-making, planning, and many other things surrounding the patient care. Yes, thank you.
Thank you so much, Iska, for that comment. And with that, we come to the end of the meeting. Thank you for making the time and staying to the end. I posted the email on the For-PHC email on the chat. If you have any comments, any questions, suggestions, or concern, or you need help with anything, please write to that email and we'll respond to you. And I will see you next month. Bye-bye, everyone. And thank you so
Bye-bye.
much,
Thank you
Alex,
very
our
much.
interpreter. See you next month.
Bye-bye.